Okay, so just to reiterate what I said yesterday evening, the technology that I'm talking about today actually was developed in Israel initially by a team of scientists at the Weizmann Institute, and the observations about the tumor treatment fields were converted into a medical technology product by a company that is originally based in Israel called Novacure. Their corporate headquarters now is in, I think, Geneva, but the active scientists I still think are at the Weizmann Institute. So tumor treatment fields are electrical fields that are generated in the frequency range between 50 and 250 kilohertz, and the field strength is approximately 1 volt per centimeter. If you use electrode arrays that are placed on the surface of the head, the shaved head, or over other organs, you can actually get the electrical field strength to penetrate to the tumors of interest. The mechanism of action of the tumor treatment fields is still being elucidated, but it appears to be based on electrodynamic effects on proteins that are related to the mitotic spindle. It turns out as the cells change shape during cell division, the intensity of the electrical fields that are generated maximizes in the area where the cells are the thinnest, and the electrodynamic interactions with the proteins, probably mainly tubulin, are the strongest in that area. So the tumor treating fields interfere with normal mitosis, and the cells undergo apoptosis. There have been in vitro studies that have demonstrated that the tumor treatment fields lead to a decrease in cell viability. These are two different glioblastoma cell lines. The tumor treatment fields also decrease invasion and migration in cell matrix and chamber penetration assays, and also in what's called a wound healing scratch assay. And the tumor treatment fields also seem to modulate the transition between epithelial and mesenchymal phenotypes, which are felt to correlate with transition towards malignancy and metastatic potential. I think there's at least one other speaker here who can speak to the physiologic effects, the signal transduction effects of the tumor treatment fields than I can, but just to make a couple of comments, the tumor treatment field exposure seems to downregulate signaling through NF-kappa B, downregulates metalloproteins that are important in cell invasion, decreases phosphoinositol triphosphate kinase signaling, MAP kinase signaling, downregulates several stimulating molecules for tumor angiogenesis. And if you look in animal models and you add the tumor treatment fields to the kind of ionizing radiation that's used in tumor therapy, you get synergistic effects on apoptosis, double strand breaks, prolongation of H2-AX gamma, which is a measure of inability to repair DNA damage, synergistic effects on the formation of multinucleated cells and mitotic abnormalities, synergistic inhibition of migration, and also synergistic effects on radiosensitization. So these kinds of preliminary studies led to the application of these tumor treatment fields in tumors combined with ionizing radiation. In terms of trying to understand the biophysics of how the tumor treatment fields affect the cellular processes, I believe that I recognize the names of people on these papers in the audience. So I'm talking about biophysics with a great deal of trepidation because I actually went to be a doctor in the beginning, but I realized in college that once we got to calculus, I wasn't going to go too much further. So a career in computational science or biophysics was not going to be in the cards. But my understanding of this is that using computational models of the interactions between the electrical fields and protein constituents within the cell and other constituents, there's probably not a direct effect on DNA. There's probably not a direct effect on lipids and cell membranes, but the computational modeling suggests that there could be electrostatic effects on tubulin dipoles. So tubulin is the molecule that in long polymers makes up the main constituent of the mitotic spindle apparatus. And the C-terminal ends of these molecules are especially densely charged. And there are conformational change models that suggest that the electrical fields generated by the tumor treatment fields could be affecting the conformational shapes of tubulin. So this is what the device looks like in its brain tumor application. The electrodes are placed on a shaved head. There's a power supply that the patient carries like a backpack or a shoulder pack. The new improved version of this actually has a much smaller and much lighter power pack. But the patient, they do have to, for this application, they have to shave their heads. And there appears to be a threshold effect for benefit. They have to wear the tumor treatments, they have to wear the electrodes 75% of the time. So that comes out to all day, every day, and all night, 5 days a week. So the clinical trials that looked at the efficacy of this treatment approach have included glioblastoma, which was the initial target tumor, and then several other solid tumors that arise elsewhere in the body. And the endpoints that were used are sort of the standard ones for cancer studies: overall survival, time to progression, in-field versus systemic progression, and response rates. So the first study that was done was a study in recurrent glioblastoma. It was a large trial, 237 patients. It compared the treatment fields to the best standard chemotherapy. The outcomes were actually equivalent, but the FDA in the United States approved this device for treatment in recurrent glioblastoma based on a superior toxicity profile. The transformative study in adult neuro-oncology was a large phase 3 trial that compared the standard radiation and chemotherapy, which was developed about 14 years ago, to the same chemotherapy and radiation with the tumor treatment fields added at the time the follow-up chemotherapy was begun. So the standard treatment has 6 months of follow-up chemotherapy after the chemoradiation, and the experimental arm had the tumor treatment fields started at the same time the follow-up chemotherapy began. It was a large trial. The randomization was very effective. The size, the two cohorts were really balanced for all of the relevant parameters, and the molecular correlates of response in brain tumor trials to the chemotherapy and radiation was balanced between the two groups, and a very important predictive marker of outcome, methylguanidase methyltransferase methylation, was also balanced between the two groups. This study demonstrated that there was a survival benefit, both overall survival and progression-free survival, to the group that had the tumor treatment fields. So this has actually been a transformative study in adult neuro-oncology, where the tumor treatment fields have been approved by the FDA for treatment of newly diagnosed glioblastoma. The person who ran this trial actually has commented that the survival benefit from adding the tumor treatment fields is greater than the survival benefit that was produced by adding the chemotherapy. So it appears that the tumor treatment fields may actually be more effective than chemotherapy for patients that have already received the anti-angiogenic drug Avastin. And then there are clinical trials in pancreatic cancer, both upfront and recurrent, in which the tumor treatment fields seem to be superior to historical controls of chemotherapy. And a trial in ovarian cancer where the same appears to be true, that the tumor treatment fields added to chemotherapy are better than chemotherapy alone. And lastly, in non-small cell lung cancer, there's a relatively large preliminary trial that showed that adding the treatment fields to standard chemotherapy improved overall survival and also had a higher response rate, as well as longer time to progression in the field where the tumor treatment fields were applied. So I think the relevance of this to this meeting is that this is a clear example where there are biologically relevant effects of electromagnetic fields, actually in this situation on cancer, an application where electromagnetic fields are being used as a treatment. So thank you for your attention.